and welcome to our video series on hypertensive disorders of pregnancy. This is the final video in the series, and it will focus on what individuals who have had a hypertensive disorder of pregnancy can expect after their delivery in the postpartum period. In many cases, the high blood pressure experienced during the pregnancy and the associated symptoms start to go away after delivery. However, sometimes hypertensive disorders can appear for the first time after your baby is born or get worse before they get better. It is important to call your healthcare provider immediately if you develop symptoms, including headaches, vision changes, upper abdominal pain, or severe swelling in your hands after your delivery. Some people may need to remain in the hospital after the delivery for further management of high blood pressure or symptoms of the hypertensive disorder, which can sometimes last beyond delivery. Your baby may also need extra monitoring and support in hospital, especially if they were born early. If this is the case for you, ask the hospital how they can help you be with your baby as much as possible. Often there are lactation consultants, parent and baby rooms, and other options to help during your postpartum period. If your blood pressure does not return to normal after delivery, it may mean you have chronic hypertension and will need to continue to be on blood pressure medications. There are several blood pressure medications that are safe in breastfeeding. If this is the case, it is encouraged that you have a discussion with your healthcare provider about what the recommended blood pressure goals will be for you and the type of monitoring required. If you have had a hypertensive disorder of pregnancy, there is a greater chance of future pregnancies being affected as well. Therefore, it is important to talk to your healthcare providers about this potential impact so that they can connect you with the appropriate healthcare services, such as an obstetrician or maternal high-risk internal medicine specialist, if and when you are planning for your next pregnancy. The other important thing to know is that if you have had a hypertensive disorder of pregnancy, there is a greater chance that you will develop high blood pressure, diabetes, or heart disease later in life. You should talk to your healthcare provider to find out how often you should be checked for these conditions. Let your primary care provider know that you have had a hypertensive disorder of pregnancy. This way, it can be added to your medical file and your primary care provider can monitor for cardiovascular disease earlier. Furthermore, as discussed in the previous videos in this series, it is encouraged to continue a healthy diet and physical activity as tolerated, aiming to achieve a healthy body weight for cardiovascular health. After the delivery, similar to during the pregnancy, individuals may find that their mental health has been affected. This experience can be different for everybody and can include feeling down, depressed, not like yourself, guilty, or post-traumatic stress. Remember to be kind to yourself and reach out to somebody that you are comfortable talking to, including your healthcare providers, loved ones, or support groups. This concludes our video series on hypertensive disorders of pregnancy. We hope you have found the information helpful and encourage you to talk to your healthcare providers to find out about your risk for developing a hypertensive disorder in pregnancy, how you can reduce your risk, how they are treated, and how to monitor for future cardiovascular disease.